Hi, I'm Eilish. I'm a clinical nurse educator on the clinical support team at Hospice Waikato. Most people think hospice, they think end of life care, they think about the last couple of days as someone's dying. Actually, it starts a lot earlier than that as we walk alongside people with life-limiting diseases. So in the next few minutes, you're going to hear from some of our other hospice workers about what they do and how they look after patients to live their best lives.
So my name's Lana Ferguson. I am a palliative medicine specialist and I also hold the medical director role. My main focus when I'm one-on-one with a patient is figuring out what's most important to them. As a doctor, we do tend to focus on physical symptoms because they often play a significant component to impacting someone's quality of life. However, there are, psychological, emotional, social impacts of poorly controlled symptoms as well.
My name is Zoe Anderson-Howell. I'm the manager for the family services team. I get to work alongside our counsellors, Kaiathina, social workers, integrative therapist, our spiritual advisor, and our occupational therapist. When people get referred to hospice, most of the time they have been told there is no more active treatment for you. And that is quite an emotional burden, for people to hold. And so when they come to us, it's about acknowledging where they're at. Because people come and they're afraid. We don't want to come in and tell you, this is what grief looks like, this is what death and dying looks like. It's actually what's really important to you, meeting you where you're at.
My name's Sam and I'm the clinical nurse manager for the community nursing team that covers the entirety of the Waikato. So hospice care is palliative care wherever you are. If you're at home, in a residential care facility, whatever you call home, hospice can be there with you, to walk alongside you, to support you and your family and whānau, or whoever gives care to you at home. We're there to help. So walking alongside someone is what the person wants rather than what we do. So it's as little or as much as is needed. We might give somebody a lazy boy chair, one that helps them to stand from sitting. It could be as much as daily visits. And sometimes it means, hey, look, I want you to come to the house because my family need to hear where we're at in my journey.
My name is Zoe Fairbrother and I'm the clinical nurse manager for our inpatient unit. When they come to Hospice Waikato inpatient unit, it means they need the extra specialist palliative care. So their symptoms have become a little bit too difficult to be managed by their GP and by the specialists out in the community. So they'll come to us so we can provide them with that extra level of care and support. We have an incredible team of nurses who are all very relational in their practice, so they can spend that time with them, and our healthcare assistants are as well. So lots of tender loving care and support and nurturing.
My name's Carrie. I'm one of the volunteers here at Hospice. I work in the inpatient unit once a week. Hospice is made up of so many volunteers. I think there's over 600 now, and the work that they do is in very different areas. There are volunteers in our shops. There are volunteers that take up beds out to patients' families. There are volunteers that might help with life stories. It's such a large organisation, but without those volunteers working behind the scenes, I think a lot of things would not happen. So we just want to make sure that they get the best possible care in all aspects. So it may just be something very simple, like taking a cup of tea into their room, but it means the world to them.
The clinical support team is a team of senior nurses, and this team delivers education not only in-house to our own team, but to our community, to other healthcare providers, or anybody else in the community who is providing palliative care for patients.
My name is Lauren Fenn. I am the clinical nurse manager for Rainbow Place, which is the children and young persons side of hospice, and we look after children from 0 to 21. So it's really journeying alongside that child and family and bringing joy into their life and being able to support them in a way that makes life just a little less complex. I hope that they feel wrapped around and loved. It's really about building that relationship so that if we do get to that place where their child is dying, that they know that they have somebody there in their corner that they can call.
My name's Teresa Bidlake. I'm the Director of Retail Services and I look after 10 hospice shops. So we sell second-hand goods that are donated from the community. The profits we make really makes an impact by helping fund Hospice Waikato. So if we have the funding, we then have the ability to have our nurses on the road going to visit our patients. We have the medical team, we have the social workers and all of our family services helping our whānau.
So now that we've heard from all of our team members, I hope you feel like you've learnt something today about the kind of care that hospice provides across our region. And I thank you for your support for Hospice Waikato.